Hey guys, today we're going to take a look at the care plan for lupus. So in this lesson, we'll briefly take a look at the pathophysiology and etiology of lupus. We'll also take a look at subjective and objective data included in the care plan, as well as nursing interventions and rationales. Okay, so lupus is a chronic autoimmune disease in which the immune system attacks different parts of the body, causing inflammation and damage to various body tissues. So lupus can affect the skin, the joints, heart, lungs, kidneys, blood vessels, and the brain. Patients with lupus may have phases of worsening symptoms called flares, and also periods of milder symptoms. So the symptoms of lupus may mimic other disorders and may go undetected for several years. Patients with lupus should be managed by a rheumatologist. The exact cause of SLE, or systemic lupus erythematosus, is not known, but scientists believe it to be in part related to genetics. The desired outcome is to reduce inflammation, regain optimal mobility, reduce organ dysfunction, and reduce the frequency of those flares. So let's take a look at some of the subjective and objective data your patient with lupus may present with. Now remember, subjective data, these are going to be things that are based on your patient's opinions or feelings. These things could include joint pain, chest pain with deep breathing, extreme fatigue, and sensitivity to the sun. Objective data that your patient with lupus may present with includes a butterfly or malar rash on the cheeks and across the nose, swollen joints, unexplained fever, hair loss, swelling in the legs or around the eyes, mouth ulcers, swollen lymph glands, and Raynaud's phenomenon with pale or purple fingers or toes. So nursing interventions are a critical part of a care plan. So let's take a look at these. Assess and monitor your patient's skin for rash. The hallmark sign of SLE is that butterfly rash across the cheeks and the bridge of the nose. The rash may develop on the face, neck, chest, or extremities. Also, assess your patient's mucous membranes and encourage oral hygiene, because oral lesions and ulcers are a common symptom of lupus. Instruct your patient to rinse their mouth 3 times per day with half-strength peroxide. Peroxide helps you keep oral lesions clean and promote healing. So it's important to assess pain in patients with lupus, as inflammation and SLE-related arthritis can cause significant pain and stiffness of the joints. So analgesics may be necessary, but it's also good to encourage other alternatives like active and passive range of motion, positioning for comfort and to prevent contractures, and the application of warm and cold compresses to those painful joints. Patients may also complain of pain with deep breathing, so encourage deep breathing exercises to open those airways. This will reduce their pain and relieve anxiety. Also, incentive spirometers and splinting pillows may be beneficial for deep breathing exercises. Okay, because fatigue is common with lupus patients, it's important to cluster care to reduce fatigue and conserve their energy. Encourage activity as tolerated, but discourage patients from overexertion. Also, guys, lab tests like ANA, which is the anti-nuclear antibody, ESR, which is erythrocyte sedimentation rate, RF, rheumatoid factor, and CMP, or liver function tests, can help determine the extent, if any, of organ failure or dysfunction, and also the progression of the disease and response to treatment. Okay, so when considering the treatment of lupus, medications are often given to suppress the immune system, treat existing inflammation, and manage symptoms such as pain. Common medications include antimalarials like chloroquine, corticosteroids like prednisone, NSAIDs, immunosuppressants, and opioids. Monitor for GI discomfort or irritation when giving medications, especially constipation with opioids. Finally, maintaining a healthy lifestyle and staying active can help improve immunity and reduce the frequency and number of flares. A healthy diet, including fruits, vegetables, grains, also regular exercise, avoiding sun exposure, and adequate rest promotes healing and reduces inflammation. Okay, guys, here is a look at the completed care plan for lupus.
Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.